Herbal medicine is the oldest form of medicine in the world, and even today it's used by far more people than what we would call conventional orthodox medicine. About 70% of the world's population still use herbal medicine successfully. A lot of our mainstream medicines nowadays have their origins in herbal medicine. For example, aspirin comes from plants like white willow bark and meadowsweet. The contraceptive pill has its origins in the Mexican wild yam. Very, very powerful painkillers like morphine have their origins in the opium poppy. And a lot of chemotherapy treatments are based on the Madagascar periwinkle plant. So you can see that those medicines all go back a very, very long way, and some are still used in various guises today. But as a herbalist, I prefer to use the whole plant as you would see it growing in the countryside. Now, a visit to a herbalist at first glance is a little bit like a visit to your GP. But we sit you down and have a long conversation lasting up to an hour and a half. And in addition to discussing your current complaint or worry, for example, you might be suffering from migraine or irritable bowel, as well as discussing your symptoms of that particular problem, I would go into your entire medical history, your diet, what sort of exercise regime you have, your lifestyle, your job, your hobbies, how you feel emotionally, so that I could build up a complete picture of you as a person. As a herbalist, I don't treat symptoms, I treat people. And everyone is an individual. So everyone, having come to see a herbalist, will go home with a tailor-made prescription which is specifically designed to suit their particular circumstances. For example, I might have 10 clients all suffering from migraine or irritable bowel or any number of complaints. Because they're all different people, and because their symptoms, in the case of migraine, a headache or sickness, in the case of irritable bowel, maybe stomach cramps or upset bowels. The causes of those diseases are manifold. They could be caused by poor diet, by food intolerances, by stress, all sorts of things. So the herbalist's job is to find out exactly why a person is experiencing particular symptoms and to treat those rather than the effects. So we treat cause rather than effect. Things like diet are very important. You've probably heard the quote from Hippocrates, "Let food be your medicine and let medicine be your food." And good diet is very, very important for optimum health. Herbs can help support that, but the fundamentals of optimum health are down to what you put in your mouth and how you exercise as well. So a visit to a herbalist will include quite a lot of discussion about diet. Now, we don't stop you from eating all the naughty things, but we just encourage you to eat a healthy, balanced diet with a few treats thrown in for good measure. Now, while you're visiting a herbalist, we may undertake various diagnostic tests, again, similar to what would happen when you visit your GP. We might ask you to lie down on a couch and we'll gently examine you to see if we can feel anything untoward, also to look at your skin, your tongue, your eyes, all sorts of things that can help us come to a diagnosis as to where the particular imbalances in your body are. We might take your blood pressure, we might test your lung capacity, we might examine your eyes. Again, all techniques that you'll be used to from visiting your GP, so there's nothing to be afraid of. Once all these tests have been undertaken and once we've had a good chat, the herbalist will then come up with a prescription which is tailor-made to your specific circumstances. And that's generally prescribed as a tincture, which is the herbal extract preserved in a little bit of alcohol. We might use anything up to 10 different herbs. More usually, it's a mixture of 4 or 5 herbs, dealing with different aspects of the imbalances in your body, and also treating the symptoms themselves, although, as I said earlier, cause is more important than effect in herbal medicine. The herbalist and the client work together to work out a regime for achieving and then maintaining health. Obviously, we're not going to ask you to do something that you're not prepared to do. So we discuss it and maybe compromises are reached, but together we decide the way forward. Herbs are very robust, but they have a fairly gentle action, and while they're not free from side effects, they're generally reversible side effects and very mild side effects. While herbs are generally safe for everyone to use, you have to be a little bit careful if you're taking other medication, because it can interact with the herbs or with other dietary supplements and cause problems. For example, St. John's wort and milk thistle, which are 2 very popular herbs, are so efficient at cleansing the liver that if you were taking another drug like warfarin for thinning the blood, the milk thistle and the St. John's wort would flush it from your system far too quickly, so you would have to have a higher dose of warfarin. So if you are taking any medicine from your doctor or over-the-counter drugs from your pharmacist, you should always check first that it's safe to take a particular herb. Now, any pharmacist or any herbalist will be able to tell you that. Doctors, GPs aren't so knowledgeable about herbal medicines, but pharmacists know the chemical constituents, so they can tell you if a herb is inadvisable with a particular medication. Sometimes herbs are not the most appropriate medicine for a particular condition. Maybe the herbalist will discover that you are actually quite seriously ill, in which case you'll be referred back to a doctor. Or the herbalist might think that another therapy might be more appropriate. For example, if you're suffering from joint pain or spinal pain, you might be referred on to a chiropractor or an acupuncturist, someone else. Most qualified herbalists have received up to 5 years of medical and botanical training, so we know when herbs are not a good idea. So you can ensure that you're in safe hands if you go to a qualified herbalist. Qualified herbalists normally belong to either the National Institute of Medical Herbalists or the College of Practitioners of Phytotherapy. And if you look for those initials in the telephone book, you'll know that you're going to see someone who's properly trained. Okay, I'm going to be around for the rest of the afternoon, so if anybody has any specific questions they would like to ask me, I'll just be over there next to the toy department. So thank you very much for your time.